The Christ House Year-Long Volunteer Program is a full-time, one-year service opportunity working at a medical respite facility for homeless men in Washington, D.C. We have positions ranging from homeless respite care assistant to case management assistant to nurse to unit clerk and so much more. And so I think it's a really unique experience to have all of these different roles in one program and have people from vastly different backgrounds and different undergraduate degrees come together and share this one unique experience.
For some, being at Christ House is great exposure before going on to medical or graduate school. For me, this was my first job right out of college, so as a new nurse, it was a wonderful place to begin. At Christ House, I am able to practice many of the skills that I learned in nursing school. But unlike in the hospital, this is a longer-term care facility. Here, we come to really know the patients. We have time to teach them about their health and to foster independence.
I felt so connected to the community the first time I got here. And in past volunteer experiences, I've never quite been so integral to the operation of the mission. Within a month, I really felt like I knew my role and knew what was expected of me, which gave me a lot of time to connect with staff and other volunteers and the patients.
One of the biggest parts of being at Christ House is obviously being with the patients and hearing their stories of trial and tribulation, but as well as redemption and finding strength that I couldn't imagine anybody could have.
One thing that drew me to Christ House and is something I enjoy is living with year-long volunteers at Emmanuel House. Living and working together is a unique and special experience because we share in the joys and frustrations and the highs and lows of working at Christ House and the type of work that we do.
By working at Christ House, I've been able to see medicine practiced in a way that I hope to in the future. I've seen people be endlessly compassionate, extremely empathetic, and hopeful in sometimes circumstances that are very difficult. Being around people who are continuously optimistic, who are continuously battling and fighting for people who are often overlooked, has given me hope for the future of medicine and for the future of healthcare in this country.
If you want to learn about a different and unique approach to healthcare,
If you want to challenge yourself while learning about the complexities of homelessness,
If you believe all people deserve love, kindness, and care,
Be a year-long volunteer.
Be a year-long volunteer.
then you should be a year-long volunteer.